Assalamualaikum warahmatullahi wabarakatuh. My name is Suryanti and I would like to present about my presentation. The topic is about language disorder. In my presentation, there are some points that I would like to explain. The first is about definition, and then the characteristic and classification, the factors of language disorder, and then the type speech language disorder, and the last is consequences. Language disorder is a significant delay in the use and or understanding of spoken or written language. Children with language disorder have been variously referred to as language disorder, language impaired, language delay, or as having a specific language impairment. There are some characteristic and classification language disorder. The first is the aspect of language that is impaired, such as phonology, syntax, morphology, semantics, and pragmatics. Phonology is the aspect of language concerned with the rules that governs the structure, distribution, and sequencing of speech sound. And syntax is the rule system that governs how words are combined into larger, meaningful units of phrase, clause, and sentence. And then morphology. Morphology is the aspect of language that govern word structure and include grammatical word inflection that carry tense. And then semantic. Semantic is the aspect of language which concern the meaning of words and word combination. And the last is pragmatic, is the aspect of language which concern with the social use of language. And then the second characteristic is the severity, which is mild, moderate, or severe. And then the affect comprehension. There are two types of affect comprehension: receptive language and expressive language. Children who has receptive language has a trouble understanding words that they hear and read. Meanwhile, children who has expressive language has a trouble speaking with others and expressing thought and feeling. And then the third point is type speech language disorder. Actually, there are some types of speech language disorder, but here I choose the common types of speech disorder. The first is apasia. Apasia, apasia itu adalah gangguan otak yang dapat mempengaruhi keterampilan berbicara dan menulis, sehingga penderitanya tidak mampu untuk berbahasa dan memahami orang lain dengan baik. Afasia itu bisa terjadi secara tiba-tiba setelah penderitanya mengalami stroke atau cedera kepala. Ada beberapa tipe afasia, diantaranya adalah afasia Wernicke atau bisa disebut sebagai reseptif. Afasia jenis ini disebabkan oleh kerusakan otak di bagian kiri tengah, sehingga penderitanya kesulitan memahami atau mengerti kata-kata yang didengar atau dibaca. Lalu afasia Broca atau ekspresif. Afasia Broca biasanya disebabkan oleh kerusakan otak di bagian kiri depan. Penderitanya tahu apa yang ingin disampaikan, tapi dia kesulitan dalam mengutarakan. Lalu jenis speech language selanjutnya adalah apraxia of speech. Apraxia of speech adalah gangguan bicara yang tidak biasa, di mana seorang anak mengalami kesulitan membuat gerakan yang akurat ketika berbicara. Sebenarnya penderita ini gangguan otot-ototnya itu tidak lemah, tetapi hanya tidak bekerja secara normal karena otaknya mengalami kesulitan dalam mengarahkan gerakan. Lalu selanjutnya adalah dysarthria. Dysarthria adalah kelainan pada sistem saraf sehingga mempengaruhi otot yang berfungsi untuk berbicara. Ada beberapa gejala yang umumnya dirasakan oleh penderita dysarthria, misalnya bicaranya cadel, lalu kesulitan menggerakkan lidah atau otot-otot di wajah, lalu berbicara terlalu cepat atau berbicaranya dengan lambat. Beberapa kondisi medis yang bisa menimbulkan gangguan dysarthria diantaranya adalah cedera kepala, tumor otak, stroke, cedera pada lidah, dan juga bisa disebabkan oleh lumpuh otak. Selanjutnya adalah stuttering stammering. Stuttering stammering atau bisa disebut juga gagap. Hal ini bisa disebabkan oleh hal-hal luar penyakit, contohnya merasa gugup atau ada riwayat gagap dalam keluarga. Selanjutnya adalah speech delay. Biasanya jenis gangguan ini menyerang anak-anak. Jadi anak-anak tersebut mengalami keterlambatan untuk berbicara, sehingga mereka tidak mampu berbicara sesuai dengan usianya. Biasanya speech delay itu disebabkan karena kurangnya mendapatkan stimulasi dengan baik, atau bisa juga karena cacat intelektual dan juga autism spectrum disorder. And the next part is factors of language disorder. There are some factors of language disorder such as a brain injury or a brain tumor, birth defects such as Down syndrome, problem in pregnancy or birth such as poor nutrition, low birth weight, and then premature. Sometimes language disorder have a family story. In many cases, the cause is not known, but it is important to know that learning more than one language doesn't cause language disorder in children, but a child with a language disorder will have the same problems in all language. The last is consequences. The primary risk for young children with language disorder is subsequent reading academic learning difficult. We know that without diagnosis and treatment, children with such a disorder may not do well in school. They may also misbehave because of their frustration over not being able to communicate. But language disorder are a common problem in children and they can be treated. There are some treatment that we can do to help children to understand the language, such as reading and talking with the child to help them learn words such as the color, the animal, or the picture, something like that. And then listening and responding when your children talks. And then encouraging the children to ask and answer questions. And then we can do by pointing out words on sign. We can teach them how to say hello or say goodbye. That's all my presentation. Thank you, and I'm sorry if there is a mistake that I have made. Wassalamualaikum warahmatullahi wabarakatuh.